Hello and welcome to the first episode of Emory Speaks, a podcast where we talk with graduate students here at Emory about their chosen professions and a little bit about where they fit in the medical field. So we have our two inaugural guests of Emory Speaks. Could you guys introduce yourselves and tell us a little bit about you?
Sure. My name is Megan Wetterhall, and I am a graduate student here at Emory University, and I am in the Adult Gero Acute Care program.
My name is Catherine Leans, and I am also a student here at Emory's Graduate School, and I am an acute care nurse practitioner as well.
Great, well welcome and thanks for being with us here on our first episode. Could you tell us a little bit about what exactly is an APRN?
Sure, so an APRN is an advanced practice nurse that has received a degree from an accredited university. They practice in a chosen specialty. Megan and I have chosen acute care, and we work closely with physicians to offer patient-centered care.
Okay, so you're working closely with physicians. So what's the difference between an NP and a PA?
So this is a question that we get asked quite a bit, and one of the biggest differences is the way that we have been taught. So nurse practitioners are taught through a nursing school, such as Emory's nursing school, and physician's assistants are taught through the medical school, similar to physicians. So we just have a different way of looking at the patient. So nurse practitioners tend to look at the holistic view of the patient more so things like the emotional and the spiritual and psychological side of things, whereas a physician's assistant is going to focus more on the medical side of things.
Okay.
So just a little difference there.
Okay. So you mentioned that there are different specialties that you can go into. What specialty did you choose, or what have you chosen to go into?
So we chosen to go into the acute care program.
Okay.
And so that means that we take care of patients from adolescence, usually over the age of 15 to end of life. And they are acute and chronic patients with often complex illnesses. We take care of them in settings like hospitals, ICUs, EDs, clinics, physicians' offices, really in a lot of different settings.
Okay, gotcha. And is there anything, I'm kind of new to it, I think some of our listeners might be, is there anything you'd want to share with the public or legislators about, what exactly, this is that you're going to, what's this field all about? Are there any hot issues for the field?
Sure. So mid-levels are becoming more and more common. A lot of times you go into your primary healthcare office to get your physical, and all you see is a mid-level now instead of seeing the physician. There's actually a pretty big shortage of physicians, especially in the adult gero population. So you're going to start to see more and more mid-levels coming through there and sort of taking over a lot of that role at the bedside, especially with bedside procedures. So that's something that's going to be coming.
Great. Awesome. Well, thank you guys so much for joining us on the first episode. To our listeners, we'll be doing this every week, and we'll be learning a little bit about each of the different disciplines here at Emory. So thanks for tuning in for week one.
Thank you.